than a generation ago, our region emerged as a global leader in organ transplantation, which was the basis of a new science called regenerative medicine, the idea of growing tissue to implant rather than to have to transplant it. Well, now a promising startup in our region is applying regenerative medicine to treat muscle-related disorders. The company's called MyoSite, and Ryan Pruchnic is managing vice president, and welcome. Good to have you here.
Thanks for having me, Bill.
Yeah, so MyoSite, I guess the problem you're trying to solve. What did you all? You came out of the University of Pittsburgh on the research side. What were you going after?
So when we were put together out of the University of Pittsburgh, we partnered with a urologist, and his idea was, can you take the principles of regenerative medicine and adapt that to urological applications? So our lead indication that we've been really in clinical development for in the last 15 years is for stress urinary incontinence in females.
Okay.
And
so people who have trouble bladder control or whatever, often after childbirth, it's really common. A real drag at the very best.
Absolutely.
The best thing you can say about it is it's a drag. So what do you do? How do you begin to go at that?
So the way that our technology works is we partner up with physicians through clinical trials approved by the FDA and other regulatory bodies around the world, and we get these physicians and we train them how to take a small muscle biopsy from the patient's thigh.
Okay.
So that could happen anywhere in the world.
So needle into the thigh, something like that, the end of the muscle down there.
Yeah, the muscle's about the size of your pinky tip.
Okay.
And then that muscle biopsy gets sent to our facility here in Pittsburgh. And what
from anywhere in the world?
From anywhere in the world.
It's all coming here, out to O'Hara Township.
Yep,
okay.
Yep. So we're trying to be the world's centerpiece for regenerative medicine and muscle dysfunction.
Okay.
So our trained operators then take that muscle biopsy and apply the 2.5 decades of research that goes into trying to isolate a particular muscle cell that we believe that when put back into the body, it could help augment or regenerate that damaged tissue.
So it's a certain cell within the bunch of cells that they get out of the body through the biopsy.
Not all muscle cells are the same.
Oh my gosh, so you have to find that particular cell. Okay.
Yes, so that's a lot of the early research that went on at the University of Pittsburgh, was trying to find why one type of cell works different than another type of cells, sort them out, be able to grow them. So then when MyoSite came along, which licensed the technology from the University of Pittsburgh, our job was to take that research and then put it into human beings in a clinical setting, and then eventually commercialize the technology.
How long have you been at it now at MyoSite?
A little over 16 years.
16 years.
Yeah.
So, and where are you in development? Is this something that's getting close to commercialization?
Well, we always move a little bit closer every year, but basically where we're at is in late phase clinical studies. Okay. And to maybe people don't understand that you start off and you try to show proof of efficacy. You always try to show safety. So you do that, and then you hone in on a particular dose. You hone in on the type of delivery methods you want to do. And then when you finally got everything you think figured out, you go into this late phase study. And oftentimes, like we're doing, you go against a placebo. Okay. And the data's blinded to us. So this is the classic double-blind study. Nobody knows what's real and what isn't. Right, yeah. So this is really rug-cutting time for MyoSite, right? Yeah. Yeah. And since we're a new and developing company, or we have been, I should say, over the past 15 years, we have to build our staff, we have to build our facilities, our compliance, our quality, everything that we're doing for when this study finishes and we're assuming to be successful, so that we could switch and turn over from a developmental company to a commercialization company and actually have a tool to present to physicians so that they could treat their patients in a different way. Really exciting. Man, you need patient investors to bring a technology to market that might take 14 years or more. Yeah. We're part of a large, actually a medical device corporation based out of Bloomington, Indiana. Okay. And they've been incredibly supportive. So they formed MyoSite back in the early 2000s with the idea, we're going to see how this works and we're going to invest appropriately. And they've been really incredible in the sense of giving us the facilities, the monetary resources, just the general support to go down this long process and do it the right way, and not cut corners, not cut out any of the quality or compliance pieces, to do it the right way. That's amazing. Pittsburgh, obviously, the technology emerged here. A great place in general to be building a company like this? Yeah, absolutely. With all the great universities around, there's a lot of talent, and now over the past, I would say, 5-6 years, Pittsburgh's becoming more and more of a technology hub. So the people are around, and it's a great place to live. So it's a good recruiting tool for us to say, hey, come check out Pittsburgh. And a lot of people, they love it when they get here.
Really exciting. Only a few seconds left, but I assume if you get this bladder issue resolved and the treatment is effective and helps, it can be applied to other muscle groups in the body as well?
Yeah, absolutely. So we have other indications going on. Two of the indications that I also think are very exciting, well, all of them are, but ones that are a little bit different than what I discussed was for patients whose bladders just can't function at all, so there's muscles surrounding the bladder, so trying to augment and regain that control. And then also we have an early phase study where we're injecting patients into the tongue, so their tongue muscle stops working, they lose the ability to swallow or even speak appropriately like they could before. So the idea is the same. You take the good muscles from one body part and add some science and technology, and we get them back to and hopefully rebuild the bad muscles in our
Oh my gosh, what a blessing that would mean to so many people, you know, all around the world.
It's very exciting.
Yeah, really exciting. The company's called Cook MyoSite. Ryan Pruchnic is Managing Vice President. Congratulations on the effort so far, and good luck on the next step.
Thank you so much.
Yeah, appreciate it. And we'll be back in a minute with a little dollars and cents. Please stay with us.